What is the Ministry of Health? The Ministry of Health Malaysia is a ministry body established under the Malaysian government. The function of this ministry is provide medical service to the people, for example in terms of treatment provided in government hospital. And this medical can also help those who are less fortunate get treatment in the hospital. What is COVID-19 and how can it spread to Malaysia? In 2020, the people were shaken by the COVID-19 virus that spread to an disease in Malaysia. COVID-19 is a newly discovered virus in mid-December 2019 in the city of Wuhan, Hubei, China. And on March 11, 2020, the World Health Organization has recognized this COVID-19 virus as a pandemic. COVID-19 is a virus that can disrupt and infect the airways. The COVID-19 virus spread to the first time in Malaysia at the end of January 2020. A Chinese tourist who had just arrived in Johor via Singapore tested positive on January 25, 2020. At the first local case in Malaysia in March 2020 due to a public congregation religious gathering held in Sri Petaling, Kuala Lumpur. Who is involved in this problem? Involved in dealing with this case is definitely the frontline, namely the Ministry of Health. Each department within the Ministry of Health will work together to ensure that this COVID-19 network is disconnected and does not spread to others. What the effect of this pandemic? This is a lot of declining national economy and also the impact on personal health. That need to be taken care of so as not to be exposed to this virus. Because of that, everyone need to live a new way of life in order to prevent this COVID-19 infection from infecting themselves.
So now we move to the planning. What is planning? Planning phase is the setting of appropriate objective and the implementation of appropriate strategies to achieve those objectives. One of the importance of planning is planning can foster a lot of new ideas. Other than that, planning can minimize overlapping and inefficient practices. Planning done for managing COVID-19 outbreak in MOH is everybody needs to wear their face mask. We will out to sanitize our hands to remove the bacteria. In any location, such as the restaurant, the mall, the bookstores, and so on, the sanitizer was also given to the customer. If we remember, there are a lot of red tapes that split us into social distancing. Parties that are involved are Ministry of Health, MOH, the government, hospital staff, and frontliner. The goal of the Ministry of Health, MOH, is to slow down the COVID-19 pandemic in Malaysia.
Organizing is the work way which is organized and distributed to members of the company so that the organization's objective can be achieved. The importance of organizing is to avoidance of duplications of work. In addition, to promote collaborations between members of the organization. What strategy to overcoming the pandemic COVID-19? One of the strategies that Ministry of Health should make is to using the concepts of work specialization in their organizations. By using the element of work specializations is thus performed by various employers in healthy organizations. Next, by using the departmentalization concepts such as separating the organization into separate divisions or subunits. Another element is change of command. By using this element, Ministry of Health organization make orders that allow the public to comply with the SOP and wear face masks. Span of control. The another aspect. By using these elements, managers of healthy organizations are more likely to track and control employer behaviors. Then, centralization or decentralization elements. As example, for all major public health expenditures decisions, the chief financial official will be centrally filtering. Lastly, formalization elements. By using these elements, formal system is used to regulate employer behavior in healthy organizations. In conclusion, all of the six elements is very important to reduce COVID-19 pandemic in Malaysia.
So, what is the definition of decision making? As we know, decision making is one of the important process to streamline the organization or next is what is the importance of decision making to reduce the pandemic of COVID-19 in Malaysia. So first and foremost, it can maintain the productivity of the frontliners because it can stop them from underperforming or burning out. So by doing this decision-making process, it will minimize the loss of the energy that is time, money, and effort. And so, in the sense of COVID-19 pandemic, Ministry of Health can provide a circular letter that offer advices and training with a COVID-19 protection. Volunteer to be the first receive the COVID-19 vaccine in effort to convince people that country vaccine is safe and effective. A part of strategies, there are also principles of decision making to cope with COVID-19 pandemic. Okay, actually there are 5 types of principle and in MOH, the principle is used is principles of autonomy. This is because the concept of autonomy or self-rule has become the basis of patient decision making. Okay, let's move to the next part, which are what are the types of decision making is now used to cope with COVID-19 pandemic, and second, what is the condition of decision making to slow down the COVID-19 pandemic. Okay, firstly, there are 2 types of decision making. Firstly, program decision making. Second, unprogrammed decision making. Okay, so in MOH, the type is program decision making. So an example of program decision making, reordering office supplies. This is because the decision is predictable. So an example of certainty condition in decision making is MOH predicted that if MCO is implemented, the number of COVID-19 patients in Malaysia can be reduced.
The last managing issues is controlling. What is the meaning of controlling? Controlling is the process of regulating organizational activities so that actual performance conforms to expected organizational standards and goals. Now we go to the importance of controlling. Improving employee motivation. The controlling makes the employees more dedicated to their work. Their work performance will be evaluated by their superiors from time to time to see their standards of work. For controlling strategies, Dr. Nur Hisham Abdullah has instructed the subordinate staff such as the specialist doctor to serve the hospital that has a large number of COVID-19 patients and does not have enough of hospital staff to handle the patients. Next is types of controlling. One of the types of controlling is concurrent control. These types of controlling take action while the activities is still ongoing. For example, company choose the employee who have the ability and good criteria in works will be accepted, and the employees who are unfit with the work will fired. And the last is steps and stage of controlling. Determine whether performance matches the standard. The leader should participate to monitor the activities that run from time to time to make comparisons of performance matches the standard. For example, Dr. Nur Hisham should follow the current activities by help staff to make sure whether their work matches the standard.
Conclusion. What a summary we can understand from here. To ensure that the administration runs smoothly, an administration must have a systematic step. As with the Ministry of Health, to address this COVID-19 issue, the Ministry of Health must find and discuss the steps that need to be taken to prevent this COVID-19 from spreading further. As can be seen, have 4 steps, which is firstly planning. This means the Ministry of Health need to find out what the best measures can be taken to prevent the spread of COVID-19. Secondly, decision making. In this step is the step to make the best decision for all. All departments as well as level will find out which is the best step to ensure this COVID-19 can be decided. Thirdly, organizing. Here it means that the Ministry of Health needs to divide the tasks according to their respective profession and expertise. This is to ensure that the work journey goes well. And lastly, controlling. In this step, the head of the department of the Ministry of Health must ensure that what the Ministry of Health wants to achieve. This is so that the health department can do its best to ensure that what is that desired is obtained and can achieve the target as the superior wants. What can be done to curb this virus? First, according to the SOP prescribed by the Ministry of Health, this is a measure to issue by the Ministry of Health to prevent the spread of COVID-19 from spreading to people around. Second, public should use the mass gesture application. It is so easy if anything happens. The Ministry of Health will easily identify places that have been attended by patients with COVID-19. And third, keep a distance between 1 meter with others. This can prevent COVID-19 from spreading further.